First of all, thank you all for being here. It's very appreciated. This webinar is intended to be a kind of discovery webinar slash tutorial where I will be presenting the health management section of the system. So the first element I will present is the Athlete app. So with AthleteMonitoring, athlete can download an app on their phone. They can also use a web app, the one I'm using it right now. The web app works on any type of device, so it's very, very effective and very, very simple to use. The number of buttons here that the athlete will see will depend on the feature activated on the by the administrative user. So if we are going to go to the health management, the athlete can report health problems by simply pressing this button. And then they can select an injury, for example, shoulder injury. They can select the level of pain. And also they can select the date at which the injury occurred, what the athlete was doing. So this is the list of activity that is linked to the team, is a member of. And also what were you doing? So which is basically the kind of, that's the activity. And this is the, how did it happen? So this is the mechanism of injury, put in a simple term so the athlete can understand. Then there is also a switch where the athlete can say if they can still train, compete normally, partial, or not at all. Then the athlete can also enter some details and then submit the form. As soon as the athlete submits the form, then the medical staff linked to the athlete will receive a notification either by SMS or email, and then he will be or she will be able to start the follow-up and recording notes and fine-tune and adjusting the diagnosis. If it's an illness, the form is even simpler. When did you first notice symptoms? Can you still train, compete normally? Some details and submit. On the athlete side, it's extremely simple. They can report an incident just like this from anywhere they are in the world. Now, so that's the ad hoc, I will say, reporting. So they can report a problem anytime it occurs. But also in AthleteMonitoring, we have implemented, for the last 2 years, we've worked with the Oslo Sports Trauma Center. So that's an IOC research center from Norway, and they are very innovative, and they create a system, a better system to conduct injury surveillance. Injury surveillance, it's always tricky because traditionally you need to have the information recorded by the medical professional. So the athlete got injured, he goes to see the medical professional enters the incident in his database, and then after that the association or the organization pull up incidents data. So that's usually the way it works. In Oslo, they realized that they have athletes all over the country, and they realized that monitoring their Olympic athletes, they have some problem because a lot of time there are some overuse injury that doesn't necessarily require the athlete to go to see a medical professional. And also the athlete can still train and compete despite the problem. So they designed a system that is very, very innovative. It's and you can find a reference on that. I can send you the link to that as well. It's the Oslo Sports Trauma Center Research Center Questionnaire on Health Problems. So the concept is that instead of having the medical professional entering the data, then the athlete starts entering the data once a week with a questionnaire. And then when a health problem is detected, a health problem, which means that something that prevents the athlete to train or compete at the normal level, then an incident is created and an alert is sent to the medical professional, who can then start the follow-up. So the way we have implemented this is extremely simple. Well, thanks for the team in Oslo and Ben Clarsen in particular. We work with them and him in particular, hands in hand, to develop this, to implement this feature in AthleteMonitoring. So now it's making it very, very simple for the athlete. So if you want to implement injury surveillance with the Oslo Sports Trauma Center questionnaire, this is the way to do it. So the athlete logs in and start to complete the weekly survey. Then the athlete will answer some question about Did you have any difficulty participating in normal training or competition due to health problems? So then they can select the appropriate answer. Did you modify your training or competition schedule? Yes, a lot. Has your performance suffered? A little bit. Did you experience symptoms? Yes. Is it a new problem? So then the athlete can also select past problem. Instead of creating a new one, he can also update the existing one, and then you can track the severity of the problem over time. Then he continues, he can select the type of problem and the symptoms. For example, here, select a date and continue. Then, did you lose, have you missed training or competition because of this problem? Oh yes, I missed 2 days. And did you contact your medical team? No. Continue. And that's pretty much it. There is also a question here. Did you report a new problem? And then if you want, you can track medications as well, and also add additional questions of your choice to the weekly survey. So this is once a week, and so you can collect information about health and injuries, and overuse injuries and illnesses, and also, if you want, you can also collect information about sport exposure. And that's all the athlete has to do. So now I will be moving out of the athlete. So you can see the athlete has 2 choices here to report problems. Creating a new problem anytime it occurs, or also report the weekly health survey. The athlete also here have the ability of viewing and accessing their own medical history. In the login stat here, they can select the health tab. Then they can see their injury history, the different problems, and also here you have the entire log. So the athlete can just select this and then view if there are any clinical notes linked to the or files linked to their issue. Well, they can also access it. This button here can be removed as well. If you don't want the athlete to see that, that can be also possible. Now I'll be moving from the athlete to the medical staff. So I'm logging in now in the main platform. So here you have your teams, number 1, number 2, number 3. In each team you can have different subgroups. Over there you have the message and the users and different here the customization, and there you have your profile. So this is the team menu where you can access the health section. So let's say I select the health section. And now what I see is a complete list of current issues. So the athletes, the type of problem, the dates, then the notes that were linked to the share with us, the coaching staff or the performance staff to the athlete. So from here, I can see the level of participation. Green means they can fully train and compete. Yellow means they can do it, but with limitation, and red, it's they are unavailable completely. If I want to report a new problem, excuse me, I scroll down, I select report new problem. I select the athlete. I select the type of problem. So for injury, it could be acute injury or overuse injury or repetitive injury, depending on the terminology you use. You select the body area. Then you select the structure. You select the diagnosis. And then you can select level of pain. You can say if it's a new or pre-existing issue. You can set the status. And then based on the selection here, then the coach will know that the athlete is not able to participate for medical reason. Then you can set the different date, return to training, and so on. And then you can add additional information, attach the file, and attach files. If it's an illness, that's roughly the same thing. You select the type of problem, and then the diagnosis, and then you enter the information. You can also move the athlete to a different team, for example, long-term injuries. So when you have that, now the incidence is created. When you have problems reported by the athletes directly through either the weekly questionnaire or their form, they're going to be listed as here and diagnosed. So from here, you click on the link, and then you can assign the diagnosis. So now you are able to access the injury history for each athlete. So if you want to switch athlete, you just select this.
But here, let's say we are opening this one. So you have an overview of the last 6 months. You can change the date, of course, and everything will be adjusted. To open an incident, you just click on it. Then you can edit it and change the information I showed you before. Also, you can attach a questionnaire or a more advanced form like this. So, for example, if you need to report the medical information or the incident in a specific format for your federation, for your league, for your university or organization, then you can also implement this questionnaire or this form, and then you can complete it as soon as you are and link into each incident. If you need to add clinical notes, sub notes, you can do it there. Select the little plus, the pain label, then you select the tasks or the treatments. You can also add your sub note, attach file, and then you save when it's done. Those notes will be accessible to the athlete as well. Now, if you want to attach notes that are not necessarily linked to the incident, but linked to the athlete, you can select this one. And then you can either click here, add new, you enter the notes. When you see the little key, it means that only the medical personnel will be able to access it. You can also remove it. And if you remove it, then the performance staff will be able to view the notes. You can link it to a specific incident. You can attach file. And if you want to send a notification to all the staff who has access to the notes, saying, well, a new note has been added for this athlete, then you can do it this way. If you need to track medications, you can select the little pill here, and then you can track medications. In the near future, we're going to have an entire, a preloaded list of medications, but right now, you enter the medication that you need to enter, and then you can track it. If athletes are reporting the weekly survey and they are recording medication there, then you will be seeing like this, medication reported by the athlete. Now, if you want to have an overview of the data in a form of in a graphical form, you can select this little wheel here to show the different graphs. And here, this is the period. So by default, it's the last 6 months. You can, of course, change the period. You can also change the number of athletes. And if you want to select 1 or 2 athletes, you just select the athlete, you refresh the graph, you refresh you press this button, and then everything will be matching the athlete. So the first graph here indicates the data completeness. So if you are using the OSTRC questionnaire, you see the number of invitations that were sent to the athletes and the number of responses. So that's the compliance rate, basically. Here you have the number of the response rates from athletes, and you have the diagnosis rates from medical staff. So you can use those two graphs here to ensure quality control on your injury surveillance program. Under each graph, you see a little text box that you can enter your comments. In here, you have the health outcomes. So this is the incidence of all the problems. So each specific problem, you can put them in and then having the numbers. And that's the overall incidence for this particular group. This is the prevalence. So here you can see that 82%, the prevalence rate is super high, is 82%, but you can also fine tune this. And the table below gives you all the statistics that you see usually takes a lot of time to calculate. They are all here. And this is the case per athlete per year, but also if you want to have 1,000 hours of competition or match exposure, you select this, or training exposure, or match and training. Here you have the relative burden. You can see each problem you can acute injury, overuse, and illnesses. Then you can click the bar, and then you have the breakdown of issues. And for injuries, then you have the body areas, and then after that you have the structure. Just under that you have the severity based on time loss, and also the severity score from the OSTRC questionnaire. And then finally you have those classic graph that provides you with statistics about common mechanism and diagnosis and so on. If you want to generate a report, you select print, and then you have a nice PDF report with your comments, with all the graphs, with all the stats. If there are graphs you don't want, you just select this and you remove them.
If you need to export the data, it's easy. You press this button, or also you select login stats. So let's say login stats. And here you can, this is where you can export all the raw data from the different part of the system. So let's say injury surveillance. You can also select injury log if you don't use the injury surveillance, and you can have an entire list of the current problems. Well, or not the current, but all the recorded problems. And select the date here. You can also export all the active athletes, all the inactive athletes. So if you have all that, well, athletes that are not with you anymore, but you want to keep their data, you can also do it. And so to conduct studies or analysis further down. So this is the export. So you have all the stats in Excel on the Excel spreadsheet. Then you get the stats per week. You get the entire log with all the raw data here to the questionnaire, but also all the reported problems. You have all the comments, you have everything there. You have the medications. And if you have a clinical note, you also have a tab with all the clinical note associated with. So this is for the pure medical side. There is also the dashboard, which is typically the first thing that the performance staff will see, or many medical staff will see that as well. But when you click on the team name from the My Team section, you get this dashboard. And on this dashboard, what you have is here on the health column, the type of problems. So the coaches will be able to see that, and they will immediately be able to see that, well, this guy's in the red. That means that he's not available. When they press the link, I'm logged in as an administrator, so I have access to the medical section. So that's why I'm getting to this screen. The coaches who don't have medical access, they will just have a pop-up with the date, return to full training, return to partial training, return to competition, and then the note from the medical as a pop-up on this screen. You also have an health tab here where you can quickly access, well, I have a list on a per athlete basis. And then, of course, this is, if you click on the link, you get right into the EMR, and then you can start working with it. On the this color boxes here are showing the results or the compliance with the weekly survey. So if you don't use the weekly survey, then, well, this box will not be here. But if you are, then gray means the athlete didn't record the questionnaire. And here, each color represents the status based on the type of program and the severity of the program reported. If medical staff has been entering notes, then you will be able to see all the notes here. So medical staff will be able to see those notes, but also, like you see here, you have assessment. So someone did some testing with the athletes, and he put some comments. And then the medical enters some clinical notes. So you can see everything that different member of the staff are attaching to the athletes. And then once you read the note, well, you can remove them. They are not deleted, you just remove from the screen. And also you can add your own note, of course, at any time. You enter the comment, you can select the type of note. You can also enter your own type of note as well. You can attach a file, and then you can notify people. The last thing is in the team settings. This is where you can customize. If you don't want the athlete to be using the injury surveillance, or if you don't want to use the injury surveillance, you can deactivate it. By default, it's deactivated. So you can activate it if you want, or just leave it like this. If you don't want the athlete to report injuries, you see here injury tracking incidents in the module section. You just deselect athlete. And then once you're done, you save. If you don't want the athlete to view their own results, you go to report and allow athlete to view report, you select no. And then the print button will disappear on the athlete side, and they will be able to enter the data and to answer whatever you ask them, but they will not be able to view their own data. Over there, the last two pieces is where you can customize the Oslo, the introduction and the reminders for the Oslo questionnaire. You can also add your own custom questions with sub-questions, so it's very, very flexible. And And just below, you can also attach a questionnaire to the injury module. So you can put your own questionnaire, your own form, and then you can use it. And here you can customize the tasks, and then you can customize the injury mechanisms. So I think I'm on time. I show you pretty much everything. I know it's quick, but I hope I was able to present everything that you wanted to see. So if you want now, I can just open the mic. Well, you can just unmute yourself, and if you have questions, I can unmute probably everyone on the. If I can go back to the meeting, yeah, here we are. Yeah. So if you have questions, feel free to ask. I'll be happy to answer. There is no questions? Hello?
Hello.
Oh, okay.
That's all it is, right? So it's hard to
Can you give you the passwords? You can do that.
start to this again. Go into
Just have a little question for François.
Sure.
Scheduling and stuff. You can ask me some questions.
François, do you hear me?
Yes, I can. I hear you.
I just have a question because it's a lot of things for the first time, I think. But I think it's an easy system. I have a question as the medical doctor of our athletes. I'm just getting every day some emails, and I just look inside and look what kind of illness or injury it is, and then I make an update, and that's it. So is my first work just for surveillance, or is it more than this?
No. Well, no. It's not just for surveillance. I showed the surveillance system, but also if you go on, you can just when you receive a notification from an athlete that was reported or recorded injury, then you can just go to this section here, and then you will see the athlete with who reported the problem. So usually it's over there. And then when you see undiagnosed, you click on undiagnosed, and then you can sorry, you can record the details. You can assign the diagnosis, you can record the notes and everything.
Okay. I think problem is that the most athletes from our German team, they do not remember what they have to do. So the compliance is not so perfect in the beginning, I think.
Mm-hmm. Well, maybe we can have a chat a little bit after, or maybe another day, because there are ways of to improve compliance, and usually compliance can be an issue, that's for sure. But it depends what kind of information is being asked to the athlete, and the way it's being done. So usually it's always we can probably touch base a little bit after and discuss that. But from my experience, the less we ask the athlete to do, the best it is. And one thing so usually for the athlete, you can ask them to report any problem when they occurs. And also if you ask them to report the wellness questionnaire in the morning, this is usually a good way to start. So it's very, very simple. It just takes a few seconds. But one thing too that is useful is that you have a series of reminders. And for example, here for the wellness questionnaire, or for the weekly health surveys, if they have to report the weekly questionnaire once a week, then you can set SMS reminder, and let's say at 10 o'clock in the morning, if they didn't complete the weekly survey, they will be receiving an SMS from the system. Please complete the survey. Your data is important. So there are ways, but also having meetings with athletes or having coaches and all the performance staff and medical staff. presenting the system and explaining this to the athletes, it's also very, very powerful to get them on board. So it's a combination of keeping it as simple as possible, implementing the reminders, and also making sure that the athlete exactly know what to do. And then you can show that often during team meetings or camps and things like that. That's usually. There are also plenty of tutorials, but sometimes it's better when it's end-to-end with the athletes.
Okay, thank you, Francois.
You're welcome. Other questions? Don't be shy, I'm here for that.
Hi, I have another question. You talked about the questionnaires that you could choose to make them and the athletes fill in. And my question is if there is a standard selection or something of questionnaires, because I know several of the ones that were in the list.
Mm-hmm.
And how much time does that take for the athlete to fill them in? Like, I know that there are very, very long questionnaires, and a lot of athletes are lazy.
No, I know that, and that's why it's very super important to use the smallest questionnaire as possible and the less question as possible, but basically trying to find a questionnaire that provides you with the most important information, even the key information that you want to collect, and just focus on that and just let everything else, the most nice to have. Sometimes it's just better just to let it go for a little bit. But there are several questionnaires, and so for example, I don't know, this one, and we have an entire library, and then we can also preload them on the accounts, so on our users' accounts. So for example, that's psychological readiness to return to sport. So that's just basically a multiple choice. You have 10 questions, I think, and then they just tap the form. But if you have a medical record or an injury report form, yes, it could be long. But again, with the AthleteMonitoring, you can put your own questionnaire. So if you can have a very, very short one that works for you, well, that's fine. You can just put it in, and we can probably help you with that. And then also you can attach it to your medical section and then use it.
Okay, thank you. I see.
You're welcome.
Are there any recommendations or something, like for several injuries, a specific questionnaire, or do I choose this on my own?
Well, normally the one we provide by default is the simple form. It's basically just an injury report form. Sometimes it's good enough, many times. But if the more advanced questionnaire is always they are sometimes useful if you have if you have a specific policy in the organization that requires you to use a specific form. This is why you use that kind of additional questionnaire. But then that type of questionnaire is usually completed by staff. Then after, if you have questionnaire for athletes, like they are very focusing on very specific things. Like I don't know. Let me take this one. So you have, this is it is all in screening. Well, that's an extreme case, but you never know. So you have 1, 2, 3, 4, 5 questions, and every time it's yes, no, or maybe sometimes it's so it's very quick to complete by the athlete, and then you get a result.
Okay, great. Thanks a lot.
You're welcome.
Francois, one quick question. We have approximately 160 athletes amongst 8 different teams on the on our account. Is there a reason that at times it's taking up to 10 or 15 seconds to even just load on the My Teams page? It becomes very slow for it to even load the players' names before we can even access their profiles.
Well, no, it It can be slow. Well, there are a few reasons. If you have all the 150 athletes on a single dashboard, yes, it could slow down the system, especially if you have a lot of field in a dashboard, a lot of metrics, because every time it's calculated and recalculated. So that might be a question here. So it's always recommended to split the, especially if you are working on a kind of subgroup basis, to split them in subgroup, and this way you don't have well, the dashboard will be faster to load. But another thing is that we are aware of that, and we're actually looking at ways of speeding up this dashboard. So we will find a better solution than just splitting the athlete in subgroups.
Brilliant, thank you.
Yeah, you're welcome. Thanks. Other questions? Last one?
No, thank you, Frozen.
No? Well, very good. So I think this is it. So thank you very much, all of you, for attending the call. I hope it was useful and interesting.
And it was a great presentation. I think it was a lot of info. We have to digest it. And perhaps you will be getting some more questions in the next few days. This is John from Greece.
Thank you, John. Yes. Yeah, don't hesitate for questions. You can also email me anytime with specific question, definitely. And what we will do too is that we'll take the, in 2020, it's been a long time I wanted to do that, but we will be doing similar webinars for each aspect of the system, because we think that now the system is becoming very, very complete, very sophisticated. So each module can be will benefit to have a session like this. So we will be the next one will be regarding the assessment and testing module. So we'll be going through the how to record test results, or how to add your own test, or to generate reports, and so on and so. So, but you will be receiving an email as well, and if you want to join, well, you will be more than welcome.
Great, great.
Thank you, Francois. Nikki from London. Thanks a lot.
You're welcome. Thank you, Nikki, and thank you all.
Thanks. Yep.
Bye-bye.
Thank you very much.
Bye.
Really from
Bye-bye.
Germany.